Okay, I've started the recording. Good morning, everybody. Thank you for joining us for comments, questions, and kudos. This morning, we're welcoming Jamie Downs, the director of the Butler County Health Department, to answer some questions about contact tracing and what that looks like in the district, because that was the majority of questions that we got in the Bitly for comments, questions, and kudos. So for those of you who maybe are with us or watching later, thank you for including those, because that gives us a good idea of things to be sure we cover. So I want to jump off and start off with kudos, some of the good things that we're doing out there. Chad or Stan, Julie, Kathy, anybody got some good things that are happening out there in your buildings? If not, I have like a little list.
We have great things happening every day at Blackmore. We have an army of people that are welcoming everyone in the mornings. I took a picture of it yesterday just because it's so awesome. You know, it's been a new process for all of our families because we can't have visitors in the building right now, but to have the amount of staff that we have at the front doors every morning to help out. Mrs. Robertson still comes and hangs out with, helps us with crossing in the morning. I saw her out there this morning, but it's been really incredible to have the amount of support that we have from the staff to welcome our kids to the building. And so that's been a great thing for us.
Big shout out. Awesome. Thank you. Stan, you got one over at Skelly?
We've just continued to have a lot of good things happening within the building. Kids are doing a really great job, you know, wearing masks, social distancing, doing everything that we're asking. So we're seeing a lot of good things happening.
Awesome. I got to spend the day yesterday subbing in a classroom over at the high school, which was a great experience. Hanging out with the kids all day was a lot of fun. And it was in a PE classroom, so that was kind of a different experience. So that was kind of cool. Bruce, do you have anything good things going on over there at the high school?
Well, we've got lots of good things going on at the high school.
Trying to figure out. Oh, sorry. Can you hear me? Okay.
It got a little muffled.
Sorry, I think my Bluetooth just connected.
Oh.
I lost you guys. Hold on. Let me turn this back off. We'll go back. We'll go back to old school. Sorry.
Okay, there we go. Now can you hear me?
I can hear you.
Okay, sorry about that. No, we've got lots of good things going on. We had to make some tough phone calls yesterday, and parents were very understanding and supportive, and we really did appreciate the responses that we got from parents and the quick the quick responses to getting their kids home and getting things taken care of. So it's a continuously challenging situation, and our parents have been very good to work with and been very supportive. So we appreciate that.
Awesome. I'm going to read the couple that were in the Bitly. Thank you to my teachers. So this must be from a student. Thank you to my teachers for always being there to help. And then one from a family. We appreciate the food service program. The free meals have been such a blessing to our community. So I couldn't agree more. That has been an awesome piece. Okay, we're going to jump in. Again, we're welcoming Jamie this morning to talk a little bit about contact tracing, because that really was the majority of the questions, not all of them, but the majority, obviously. So Jamie, could you kind of walk us through, I think one of the question was, how does the health department decide contact tracing exposure? This one was specific to a classroom. One of the questions, a couple of them were around seating charts. How does that impact? So could you kind of walk us through what contact tracing looks like so we have a better understanding?
I can. Well, one of the first, because I kind of saw the questions, and I noticed that everyone is using the CDC guideline. Everyone know that. Can you hear me?
I can now. I lost your sound there for a second.
Sorry.
That's okay.
Anyway, CDC is saying 15 minutes or longer. In Kansas, KDHE is still saying 10 minutes or longer. So we still use the 10-minute guideline when we do the contact tracing. And that's cumulative time. So I really want to stress that. So, you know, you might be around someone 2 minutes at 9 a.m. and 5 minutes at noon and 5 minutes at 3, and at 5 there's another 3 or 4 minutes. So that's a total of 10 or more minutes, cumulative. And this is in the infectious period. So just want to clarify that. When we do contact tracing, it's done several different ways. We contact the person that's positive and say, okay, here's when you start having symptoms. Let's go back 48 hours. Who have you been around in close contact? Within 6 feet, for more than 10 minutes, again, cumulative. Who do you identify as a close contact? For school settings, we reach out to the school and say, you know, in the classroom, you know, the seating chart, who around this student has been within 6 feet. And if they send a drawing of the class from a diagram, we ask for the spacing between the desks so we can determine, is it 6 feet, is it not 6 feet? And then we also ask, do the students stay in their desk or do they get up and mingle? Do they lean over, talk to others? We ask about masking. Were they wearing a mask? Was it being worn appropriate, you know, correctly? Was it covering the nose and the chin? So those, you know, are they involved in sports? I mean, so there's a lot that goes into the contact tracing, but a lot of it is with the positive person who they feel they've been in close contact with. This is new with schools trying to figure that out, determining. And what we're finding is even though they may be, you know, their seats may be 6 feet apart and they may be wearing masks, there's mingling going on. And so there, that 6 foot distancing is not being maintained at all times.
So once the contact tracing piece has been done, how are some of the decisions made with the length of time? Is it 10 days? Is it 14 days? Is it, how are some of those decisions made?
Okay. For isolation, so someone who's positive, their isolation period is 10 days, and that 10 days starts the date they started having symptoms. If they've never had symptoms, then that 10 days starts the day of their test. Some people, by the time, you know, they've had symptoms, they get their test, and by the time the test result comes back, they're already 7 days into their 10-day isolation period. So they only have 3 more days of isolation, as long as their fever has broke and their symptoms are greatly improved. Quarantine is 14 days from date of exposure. So if we say today we get notified someone has tested positive and making contact of who they've had contact with, well, it's been 3 days since their last contact with that person. So their quarantine is really only 11 more days. So it's all based on last contact for the quarantine person and date of onset of symptoms to figure out the isolation period. But quarantine is 14 days, isolation is a minimum of 10 days.
And that becomes, that's a really hard piece to kind of wrap our head around, because what would happen if the positive cases in my house, let's say, we'll add a little scenario here, the positive cases in my house, so that person is isolated for 10 days. And the family then with contact tracing, are they in quarantine for 14 days?
Actually, when it comes to household, they are actually in quarantine for the time that the positive is in isolation.
Okay.
Plus an additional 14 days once that positive is released from isolation. So there could be household contacts could be in quarantine for 24 days.
That's a lot to start to wrap your head around, right? Especially when this is all brand new to all of us. So yeah, so if I had a positive in my house, that person, that individual, we'll use the puppy's name. We'll call him Malik. Okay. Malik gets sick. Malik is positive. Then he's in isolation for 10 days. And our quarantine doesn't start until that isolation is over, correct?
That's correct.
Okay, so I know that we have several people in the attendee room. This is just a quick reminder. Remember that you can go into the chat room or in the question and answers, because I'm monitoring both of those things. If you have specific questions, if that helps clarify, if that doesn't help clarify, be sure to kind of ask those questions in there, because that's how we can continue to answer questions and clarify things. Okay, so I have a question. If a person in the household is being tested and awaiting results, should the household members stay home until the results are received? That's a great question.
The only person that would really need to stay home is the person being tested. What we tell people that are coming through for testing is to assume you're positive and isolate till your test result comes in. The family does not need to quarantine till they know what that test result is. Now, they're welcome to go ahead and stay home, but that's not something we would ask them to do.
Okay, that's a great question. Okay, so one of the questions was about, and this is about a different school district, so I'm just going to kind of leave the school district's name out of it. But why was another school district allowed to only miss one game when they had a positive case on their team? Does that have to do with the length of isolation? Is that some of the timing that is involved in that?
It could be length of isolation. It could be when was the last contact. There's a lot that can come into play with that. So yeah.
It could be when symptoms first started for the positive. It could be when last contact happened. It could just be the timing of when their games were.
It was, and it could be that the school canceled that game out of precaution, and then afterwards it was, found out that, okay, this student really hasn't been here, so we can go ahead. There's a lot of things that could come into play for that.
Okay, we have another really great question in the question and answers. I was told the county is in red. Is that true, and how will that impact schools? And I'll talk about the school part in a little bit. Jamie, do you want to talk about if we are in red?
Not that I was aware of, because I know just was meeting with another school yesterday, and as far as our hospitals, we're in green. Yesterday, our positivity rate was still kind of down in the green yellow level. So I'm not sure what red they're talking about. And the other thing I want to point out is for here at the county, we have pulled out the correctional numbers, and I know the state has those numbers in the data on the state dashboard.
So on the school side for that, yes, we meet every week, Thursday afternoons, to talk about, we look at all of our data. We have an Excel spreadsheet where we're pulling that data off of the state website. They have a COVID page that has a school metrics piece on there. When you pull that up originally, you get the entire state, and then you can filter it by our county. So we filter that out by county. We pull all of that information into that Excel spreadsheet, mainly so we're all looking at the same data and same information. There are a variety of different people on there. We have parents represented on there. We have the health department joins us. We have some medical folks on there, building administrators, district administrators, and we have board members on there. We all sit down and kind of once a week look at that data. And there are other districts that are doing that every other week. We're choosing to do that weekly right now. Our data has looked really good. Every time we've gotten together, we look at the percent of positives. We look at the number of cases per 100,000, so an incident rate. We're looking at our number of quarantines and positives. We're looking at ADA. We're looking at hospital availability. And we're also looking at the county's website that has the numbers by zip code, because we know Butler County is a very large county. And so we pull that information by zip code so that we can try to have the best information we can when we make those decisions. And right now we still feel like we're in the green section, and we are still planning on being continuing forward with our in-person pieces. So we feel like we're in a pretty good spot right there. How many positive cases have developed out of students that have been quarantined in Butler County? That's a good question.
It is, and I don't have that data in front of me.
Yeah, out of the.
And that's all still being tracked right now. And I couldn't, and to be honest, I don't know. We have so many that are in quarantine that we have referred quite a few of those to the state to follow. And so we don't know till they refer them back to us as a positive and do that tracking. So I don't have that answer right now.
Okay, so and some of that is a little, it's sort of like the chicken and egg piece, right? I mean, they're a little kind of related. Once you have a positive case, the whole reason we quarantine is so so Malik is ill, and let's say the family goes ahead and quarantines, or the contacts quarantine. The whole idea is to have that time to watch for symptoms. That's the incubation period is 14 days. That's kind of how that works. And so could there be quarantines that come out of that original positive case that then maybe somebody else in the household gets sick, or somebody else that was exposed gets sick that has been quarantined? I mean, it's kind of like a chicken and an egg piece, right? I mean, they kind of go hand in hand a little bit.
Right. Yes, and that's the purpose of the quarantine is the potential, so Malik was around 10 other people. So those 10 people are being quarantined because the potential is they could become positive. So if we can quarantine them, then we can prevent them when they do become symptomatic, if they become symptomatic, from then spreading to 10 more people each. So it's a way to slow or potentially stop this disease from spreading further, or keeping it at a minimum.
And that was one of the questions that just came in. Can you clarify what quarantine means? Quarantine really means that you've been exposed. Jamie will correct me if I'm wrong. You've been exposed to the virus, and you're quarantining for what would be the incubation period to make sure to see if you have symptoms, and that you actually don't have the disease. Hopefully that would be the fingers crossed piece. You wouldn't want to get that disease if possible.
Correct. I talked to a family yesterday, and what I explained to them is, think of quarantine as caution. We're watching, we're waiting. Because I know some people think quarantine, I have to put myself or my child, whoever's in quarantine, into a room and lock them in a room or shut them in a room. And that's not so much quarantine. Quarantine means they have to stay around the house. They can go outside and play in their backyard or in their front yard, just away from other, outside people. They can be around their family, but it's caution, it's watching. Now, when somebody is positive and in isolation, then we do say, put them in a room away from the rest of the family, so that just to protect the rest of the family from potentially decreasing the chance of getting it. We know in households, the chances that it'll go through everybody is great, but if you can, isolate away, it potentially can, decrease the number in the household that then get it.
So I think this question kind of goes hand in hand. So why are students that have negative test results not allowed to return to activities? Would that not have to do with the fact that they're still in that incubation period?
That's correct. When someone is put into quarantine, they can go get tested, but a negative test will not get them out of quarantine, because we know that it could be take 14 days to have enough virus to show up on a test. So yes. So if you've had a close contact, been put in quarantine, a negative test will not get you out of that quarantine. Now, if you haven't had a close contact, haven't been identified as a close contact, and you're having symptoms, and say you're sent home from school or work, and you go get a test and it comes back negative, then you can return to work or school. It's just that
your doctor's office may do a COVID test and a flu test, and maybe the flu test is positive and the COVID test is not. And so then there would be no need to isolate because it's flu, it's not COVID.
Correct.
Okay, let me go back up here. Can you readdress the last question? Can you readdress the last question concerning other county schools had a positive football player?
I think when it comes to other schools and sports, it's a case by case, and it depends on what all has been submitted. And I know schools are canceling things without ever having talked to us at the health department.
Yep. So some of that really does have to do with, my guess is what we talked about earlier. It's exposure time. It's when was onset of symptoms, timings of games and cases. It just sort of depends on each situation. That's a good, okay, here's a good question. How many positive cases are at each school? Is that information available somewhere to view regularly? That is, we have what we call a surveillance report that is on our website and is released every Friday. We also send it out on social media so that people know. It looks at the number of positives, and currently it looks at the number of positives and the number of quarantines in both students and staff together. It is not broken down by building. It is simply at the district level. And there may be some tweaks in that as far as pulling some of that information together moving forward. It may look a little different, but we are keeping that out there so people know kind of where we are and what things look like for us. Again, the data that we're using is on the state and the county websites, and then that piece is kind of our district level information, trying to be as to kind of put everything out there that we're using. This is really hard to look at my camera and read at the same time, so I hope I'm doing okay. Okay, I think we've answered all of those. Let me go to the question and answer. Okay, some clarity as to why teachers and students in classrooms were sent home of the positive students. Aren't protocols in place that are, we do have protocols in place that are meant to prevent. We're doing our best to social distance. We're doing our best to have masks on. Those things are our building principals, our teachers, our staff are working really hard to keep the buildings clean. We're sanitizing, and we're trying to do all of those things, but those are all preventative measures. The analogy I used the other day is it's a lot like using sunscreen when we go to the beach. It's a preventative measure, but I don't know if I'm the only one, but sometimes you miss a spot right on the back and you get a little sunburn. And so we do our best to keep everybody as safe as we can and follow those protocols. But it's not perfect, shall we say. Am I wrong? Somebody nod and go, yeah. I mean, I think our buildings are doing a great job trying to keep things as clean as possible and keep our folks as safe as possible, and our kids and our staff. So that's a great question. The surveillance report that comes out each week, are those cumulative or those currently are active? Those are what we currently have active for that period. So at that point in time on that Friday morning, we pull those numbers that are currently positive or quarantined, and that's the information that we get. It is not a cumulative. It is kind of real in-time moment, if you will. If one family member is positive and in isolation, are you having the entire household quarantine?
Yes. If one household member is positive, then we require the whole household then to go into quarantine. And a lot of that, and again, we are finding that when we're doing our contact tracing, we'll have some people that don't tell us all the people in the household. So our isolation and quarantine is as good as our contact tracing and the information we get from our people. But yes, but bottom line, if one person in the household is positive, the whole household is to quarantine.
All right, I have a question from the Bitly that is not COVID related, but we'll get back to them if you have some more in the chat room, just a minute. And this one I think is more for the high school. It has to do with painting parking stalls. We did some work this summer, and so the question came up of will seniors be able to paint a parking stall? It's a good question.
Well, we met with both our Stuco sponsor and our maintenance supervisor. I brought them into the same room and said, can we come to an agreement where we could allow for the students to paint a parking stall and not have it deteriorate the brand new ceiling that we put on in our parking lots, either one of them. The conclusion we came to was that because we share the parking lot and to the east with the city, and that the city was the one that was so kind as to pay for an entirely new parking lot over there, that we would leave that decision up to the city. And so that one was off the table, as the paint damages the seal and the new asphalt, and so that was not something that we were going to allow. So we looked at the west parking lot, which we as a district paid to reseal and look at, and in order for us to be able to put down a protective coating or something along those lines, our Stuco sponsor basically brought that back to our Stuco students and said, okay, here's what we would need to do in order for us to have the painting allowed. And there was not enough interest to justify allowing that process to go, and so we did not pursue it any further. It's a really cool thing for our students to do, but basically what we came down to was it was kind of a fundraiser for Stuco, and if we're going to do a fundraiser that raises $5,000 over the course of 10 years, but then we have to pay $15,000 to resurface our parking lot every 10 years because we're doing that, then maybe we should find a different way for us to help fund Stuco through some of that same money that we would maybe pay to do the parking lot every 10 years instead. So when that was taken back to the students, there, like I said, there was not enough of an interest that we felt like we needed to continue to pursue that, and for the labor to put all of that in place for such a small number of students who were interested in doing that in that space.
Thank you. All right, there's another question, and this is a good question. What is the survival rate of high school age person that is infected? I don't know that off the top of my head.
I don't know that off the top of my head either. I know that from the beginning, we know that deaths in children under 18 have been very minimal, but we know it does happen. I think the Johns Hopkins website actually has the breakdown worldwide by age groups of how many deaths that could be checked out, but I don't know the exact number or a percentage.
And there is, off the top of my head, it's either the incident rate or the positive rate that the state website breaks it down by ages, and we are also pulling that information when we pull and look at our gating criteria data, so that we're keeping an eye not only on countywide information, but also broken down by age levels, so that is a piece of our puzzle, obviously. Will our sports teams be placed in quarantine as a group, and will they be allowed to practice to continue to condition? I don't think we've had that conversation yet. Off the top of my head, my guess is that they would have to condition on their own, because they wouldn't be allowed to be together as a unit under football guidelines. So I think that one they'll probably, if I'm reading that correctly, I think I'm reading that one correctly. Okay. Oh, will there be an announcement made about the rest of the football season? As soon as we have end of release from quarantine dates and we can make some decisions moving forward, absolutely. But I've said this before and I'm going to say it again. Our goal is to get kids out there on the field and on the court and to do everything we can make that happen. So that our plan would be to move forward as quickly as we possibly can, maintaining those pieces. Okay, we said we typically go about 30 minutes, and we've answered all the questions in there. I've double checked the list from the Bitly list, and we seem to have hit, oh, there is one we haven't hit yet, and this is a good one. Has to do with middle school. Will there be wrestling for middle school? As of right now, that is the plan. They would be at the high school before school for practice. So I believe we, in my conversations with Mr. Bang, we have a bus that'll be taking kids over, and that's the plan right now, but we'll be definitely moving forward with that as we get closer to wrestling season. But that's a great question. Glad we could answer that one too. So we'll go ahead and sign off. Jamie, I really want to thank you all for, and Julie and Doug and Bruce and Stan, Kathy and Chad, thank you for joining us this morning. Before we go, if for those of you in the attendee room, if you would like us to continue to do these, this was our last one we had scheduled right now, just type a yes in the box and that will let us know if you'd like us to continue with these, if they're helpful. Until then, I have a launch. So Jamie, again, thank you for joining us. And your launch for this morning is, and I don't know who this is from, but it says who the quote is from. It's anonymous. It says, don't just adapt to the energy in the room, influence the energy of the room. So go out there, Wildcats, do great things. So go Wildcats. Thanks. See you all later. Have a great morning.
Bye-bye.